All right. Good afternoon, everyone, and welcome to our inaugural Early Childhood Grand Round seminar. My name is Dr. Morgan Crossman, and it is my honor to serve as the Executive Director of Building Bright Futures, which is Vermont's Early Childhood State Advisory Council and Vermont's Early Childhood Data and Policy Center. And I'm thrilled to be joined by our Research and Data Director, Dora Levinson, who is kind of co-supporting today's session alongside the Building Bright Futures team. And for those of you who are new to Building Bright Futures, we serve as Vermont's early childhood public and private partnership, charged in both state and federal statute as Vermont's Early Childhood State Advisory Council, which is the mechanism by which we advise the governor and the legislature on the well-being of children and families prenatal to age 8. Our mission is to improve the well-being of children and families in Vermont by using evidence to inform policy and bringing voices together to discuss critical challenges and problem solve. One of the primary roles that we play in this advisement is to ensure that our legislature, the administration, and our federal delegation are both accessing and utilizing the most up-to-date, high-quality data, as well as the voices of communities to inform decision-making. One thing that's really critical to our advisement in this space is the Vermont Early Childhood Data and Policy Center, which is a nonpartisan independent source of data, research, publications, and important information for our policymakers and stakeholders on all of the issues and priorities for children prenatal to age 8. And so the center is a mechanism by which we are centralizing all of the early childhood data, the very complex data on our system, and trying to make that data publicly available. Early Childhood Grand Rounds is a new mechanism, and it's a convening mechanism that we are using to both elevate and disseminate high-quality data or data-related topics in this early childhood space, topics that are impacting our early childhood sector, data challenges that we are actively discussing, and bringing national best practice to our state. So I'm really excited to be here this afternoon to moderate an incredible panel of experts discussing equity-focused data efforts in the early childhood arena. So a couple of logistics for today. First, I want to ask that everyone please turn their cameras off and mute yourselves, which I am seeing that you are all doing. Later in the discussion, I am going to invite you to turn your cameras back on. So once we transition to the question and answer portion, I do want to invite you to turn your cameras on. I also want to ask everyone that's in our virtual space today to introduce yourself in the chat. So anything that you're willing to share, your name, your role, your organization, whether you're a parent of a child under the age of 8, and where you live, whether that is in Vermont or you're joining us from across the country. For today's seminar, the first 30 minutes are going to be a moderated panel, and then the last 20 is going to be a question and answer discussion section. So I want to encourage you, as you're hearing our panelists speak and talk about their work and the challenges they're facing, pose questions to them in the chat as we go along, and our team will be capturing those and bringing those back into the space during the discussion section. I also want to note that for anyone who is interested in receiving continuing education credits for today's seminar, you can email data@buildingbrightfutures.org. We are really excited to offer that for today's session. And if you've already connected with a member of our team, please consider that aspect handled. And lastly, I want to recognize that we are recording today's session. We do intend to share this with partners who couldn't be with us this afternoon. And we want to thank our direct service providers, our educators, and folks who are actively working with our kids who are not able to be here today. And we will do our best to schedule future events at a variety of times to honor that. So for today's session, why are we talking about equity in early childhood data efforts for our inaugural Early Childhood Grand Rounds? I want to give a really important shout out to the Building Bright Futures Data and Evaluation Strategic Plan Committee. This is a really phenomenal group of both public and private partners, over 30 people who are coming together on a quarterly basis to discuss early childhood data efforts, challenges, and opportunities in the state of Vermont. And this team has identified equity-related data efforts, specifically with a focus on the challenges associated with demographic data collection as one of the most complicated and important challenges that we tackle over the course of the next couple of years. And this was really resulting from the recognition that we don't currently have the ability to have the full picture of who we are serving, whether or not we are missing specific groups or communities when we're administering programs or delivering services. So in order to support decision makers with making data-informed policies that truly reflect the needs of all families and children in the state, we recognize that we need to capitalize on efforts to elevate both quantitative and qualitative data to tell the true stories of those with lived experiences as marginalized or vulnerable people in our state. And ultimately, having the goal of providing children, all children and families, the opportunity to thrive. And as a network, for those of you who are part of the State Advisory Council network, we issue a series of recommendations and did so over the last couple of years on reducing inequities in data collection and reporting that's going to be revisited this year as part of our slate of recommendations. So we felt like it was a really important time to bring in some additional content expertise to help us operationalize this work. So today's panelists were selected by our Data and Evaluation Committee as 3 of the nation's leading experts in equity in the early childhood arena and related to equity data efforts. So it is my honor to introduce 3 of our incredible colleagues and panelists: Dr. Iheoma Iruka, the founding director of the Equity Research Action Coalition at UNC; Carlise King, who's the executive director of the Early Childhood Data Collaborative at Child Trends; and Dr. Shantel Meek, the founding director of the Children's Equity Project at Arizona State University. And I'm going to ask a member of my team to put a link in the chat to information we've compiled on our panelists. It includes their bios, their websites, social media handles, all of the different ways that you can get in touch with them after the panel today. So I'm excited to bring our panelists into this space. And I want to start by giving each panelist 3 minutes to introduce themselves, to tell us a little bit about their experience with equity-focused early childhood data efforts. And that might include the work your organization and your team does, how you approach this work, and some of the very big topics that you're tackling. So Dr. Iruka, we'll start with you, and then we'll go to Carlise and Shantel, and we'll keep that order throughout the session.
Well, thank you so much, Dr. Crossman. And, 3 minutes for some of us, because I was just doing a 3-hour lecture for class, could be like seconds. So, but I'll be as considerate for my esteemed panel. So I'll be brief, but I do want to thank Morgan and Dora and the whole Building Bright Futures Coalition and team for just allowing me to be here and engaging with you all. So I'll just briefly say, in terms of the question you asked, that the Equity Research Action Coalition here at UNC was formed when I returned in October 2020. And we really focused on sort of 4 big pillars. One of them is re-examining the early childhood literature using sort of a critical analysis lens, examining policies that actually lead to equity around wealth and health and access to educational excellence for minoritized populations, mentoring early care and education scholars. And then the last one is really around the counter narrative when we translate our materials and information. And to me, that's probably a lot of, when I think about the issue of data and equity, is in my view where it sits, particularly in some of the areas that I work in, because data has to be able to communicate something, right? You're collecting data for a reason, whether it's to benchmark, programs, whether it's to decide where the gaps are and how to fill it. And one of the things that I think about with data and equity is that, at least when I think about the work I do, particularly around the Black diaspora community, is around counter narrative. When you're a member of a community that is often marginalized, thought of as lazy, as not valuable, as not human in many regards, you're trying to use the data to really reorient people to their humanity, to their civil rights. And so for me, part of data and equity is really that we have to use it in a way that says, let me show you the full humanity of groups of people and make sure that we attend to the best of who they are and remove barriers that may be in the way. And so when I think about that sort of work, I think about that through the work that we do at the Equity Research Action Coalition, but also with partners, like Shantel, obviously the Children's Equity Project, and obviously also Carlise at Child Trends, is that data and equity has to really lead to some sort of action that leads to a better outcome somewhere.
Thank you. Carlise, let's go to you.
Sure, and thank you for having us. Again, my name is Carlise King, and I'm the Executive Director for the Early Childhood Data Collaborative. My experience with equity-focused early childhood data efforts really centers around policies and practices that support the development and use of state-coordinated early childhood data. And I think Morgan touched on it a little bit, sort of as we think about the data that we have available about early learning experiences right now, sort of we think about and picture it as like this big puzzle, right? A lot of the information that we might need to really take action is disconnected, housed in multiple different data systems, uncoordinated, or managed by different federal and state agencies. So often when we're thinking about equity and different identities that communities hold, we talk about the intersectionality of different identities, but we also need to understand the intersecting experiences of children and families as they navigate through multiple systems. As they are not gaining access to services. So for example, we think about the importance of integrated data in terms of a child may be receiving food and nutrition services, but also eligible for public preschool or other services, and those are not being connected. So really thinking about how when we're not connecting these data, we really don't have a full array and of the services that children are receiving in communities and those that are not being served. But I think what I can share through this conversation is really good news in that we're seeing many states are advancing efforts to integrate their early childhood data. In fact, we just did a report on the PDG applications and found that nearly 80% of states were involved in some type of data integration activities. And that's really focusing on and developing early childhood integrated data systems, which combine program data, workforce data, and data about children from multiple systems. And this really allows us to have a better 360 view of access to services, workforce gaps, but also to be able to look over time at children's educational trajectory. Like a lot of times we are getting just a snapshot of information and instead of really understanding progress over time for children. And part of that is the way that we collect and that we connect data. And sort of our work is really conducting national surveys and case studies to understand the progress and goals of data integration in states, but also to provide policy recommendations and strategies that advance this work in a way that centers equity in terms of the questions that we ask, focusing on not just on outcomes, but the processes and policies that are meant to support children and families. And we've looked at this in terms of early childhood integrated data systems, but we've also examined data issues on specific systems such as Home Start, Head Start, home visiting, and also workforce data. And I'll share in the chat a report that Minnesota had done examining children's participation in their food nutrition program, financial assistance, and early childhood programs that they were able to look at by income, race, and ethnicity, and then a new framework that we're developing called Systems Transformation for Equitable Preschools, which I know my colleagues, we have leaned on them as experts in informing this, called Step Forward with Data, that's really looking to see how we can use data to transform preschool systems. But overall, our work really focuses on how can we improve access to data that's really going to improve families' access, experiences with, and outcomes related to early learning. So I'll put those in the chat, but thank you for having me.
Thanks, Carlise. All right, and Dr. Meek.
Thanks. So honored to be here with my esteemed colleagues. Thanks so much for having me. I'm Shantel Meek. I lead the Children's Equity Project out of Arizona State University, or the CEP for short. We do a lot of work across research, policy, and practice and professional development, with policy really being at the heart of what the Children's Equity Project works on and is all about. All of the issues that we work on are really exclusively focused on advancing equity and making our systems more fair across the many systems that touch the lives of kids and families. Early care and education is where we do a bulk of our work, but we also work on K-12 education, immigration systems, child welfare systems, a lot of work on early intervention and early childhood special ed systems, and so on and so forth. A big part of what we do, kind of in relation to this discussion on data, is really to identify inequities where they exist, identify disparities where they exist, highlight where those exist, and importantly, operationalize the solutions, right? Operationalize what equity actually looks like in policies, in budgets, in laws, in practice, in the classroom, and so on. So I think the way that we approach our work largely is really was born from a framework that was part of a report that actually my colleague, Dr. Iruka, and I and a bunch of other colleagues published a few years ago, that really builds out an equitable system as one that addresses access, experiences, and outcomes, or AEO for short. And what that means is that all the work that we do is informed by history and understands the context kind of across systems, but in really trying to identify where contemporary issues exist, we really think about who has access to resources, who has access to services, to programs, to supports, to resources, whatever they may be, right? For who is it hard to access those resources or get in the door or get in the programs, and for who is it easier, and why do those differences exist? Once children and families are receiving a program or a service or a resource, what are their experiences within those systems and our programs and our services and supports, right? How do those differ based on, social demographic characteristics and all of the isms attached to those socio-demographic characteristics? And then what are the outcomes that we see that are a result of our programming, services, resources, supports, whatever system it is that we're looking at? And importantly, of course, right, what do those outcomes look like by group? And where do those disparities exist, so we could trace it back to what the system is doing in terms of experiences, to what the access looks like, the dosage, the quality, the quantity of the access, and so on. So when we think about data, we think about what we're collecting and how we're collecting it to better understand kind of those three really concrete touch points. And of course, the E, or the experiences, as Carlise mentioned a minute ago, is so critical, but is often the one that is attended to the least in data, the one that is probably the hardest and most complex to collect, and also the one that we're missing most often, but is obviously critical to the outcomes that we're seeing or not seeing, to the fairness in the system and the equity in the system or not. So we work really hard at the Children's Equity Project to use, we do a lot of secondary data analysis. We collect some data, but a big chunk of our work is really using big national data sets like the civil rights data collection from the Department of Education, the 618 IDEA data for children with disabilities, census data, other sources, and data sets that other organizations have already put together that have kind of combined and brought together several different databases like the Opportunity Index and Kids Count and other sources like that, and use those pieces to, again, identify where inequities exist at a local level, at a state level, and nationally, and then try to identify and evaluate different systemic reforms and changes and policy changes to address that. So I would say that in terms of data, right, just building on what everything my colleagues already said, really using it at the CEP as a really important lens and tool to pressure and move policy, identify where there are problems, identify where there needs to be more resources, where policies are having intended or unintended consequences of widening disparities, and really using it to push for more equitable, more fair, more quality systems for kids and families.
Thank you, Shantel. The second question that we want to hear the three of you talk a little bit about is something that we've been talking about through our Data and Evaluation Committee for the last probably 2 years, around the challenges associated with demographic data collection, and that there are federal requirements that put in place some guardrails around how they would like us to be thinking about demographic data collection, but how we truly are thinking about capturing the experience of the people that we're trying to serve in our states and across the country. So can you talk a little bit about how your team and entity has addressed or tackled demographic data collection, and any challenges that you have experienced in this arena?
So I'll go first. So I will, I'll share a couple of examples. And not necessarily all early child related, but a couple of them are. So I'll just share a couple. So one is we are doing a project here in North Carolina funded by the Blue Cross Blue Shield of North Carolina Foundation. And really is to sort of identify sort of the inequities that may be in early child programs, particularly looking at racial, ethnic, and socioeconomic sort of inequities within programs like child care subsidy, Head Start, pre-K, early intervention, et cetera. And what we found is that we, first of all, get into data that actually tells you the racial and or ethnic makeup and or socioeconomic, other than whether they qualify, getting that data and having it be accurate and complete and standard across the different programs is actually challenging. And so what we ended up doing is actually looking more at the sort of the neighborhood across the state of North Carolina. So we use the Child Opportunity Index, which it captures like 29 neighborhood indicators around I think like socioeconomics, health and environment, and education, and we sort of layered that on top of at least the data we have from the census, right? With the census data that has all the census track around sort of race and ethnicity makeup, we're able to do sort of geography. So if you're a Black majority sort of area, or Latino or mixed race, we're able to do that and able to layer that data to give us a more refined data in terms of at least equitable opportunities to some of these early child programs. And I would say, because we didn't have such a refined number at the programmatic level, we end up having to use the neighborhood, because we figured many people who live in a neighborhood are probably going to use the programs in a neighborhood, not always one-to-one, but we made that assumption as part of it. And I think that, what it does remind us is that while there may be standards around how to collect sort of demographics or some things, is not always used the same way in terms of data collection. What do they do with missingness, all that kind of stuff. So I think it's something to think through is how much you sort of try to get data and make it complete, or how much you use other existing data like the census data, like the ACS data. Again, recognizing that with ACS, for example, the American Community Survey, that we are seeing a level of non-responsiveness, particularly from our Latino population and our Black population. So it's just something to recognize there. The other example I did want to share is, so I am a senior advisor for the National Urban League and also sit on the U.S. Census Bureau's National Advisory Committee. And I bring that up to sort of make note, particularly around the demographics. So if you know right now, there's an interagency between the Census Bureau and the Office of Management and Budget that's really going to revise, is actually proposing a revision to the way we collect race and ethnicity. And so I assume with the state of Vermont, you collect a two-parter. You have your Hispanic question that says, are you Hispanic or not? Yes or no. And then you have your race question that basically says, which group or groups do you fall into, whether it be Black, white, Asian, American Indian, multiracial, blah, blah. So now they're proposing to combine that. And as a researcher, I usually combined it. I was like, if you select Latino, Hispanic, I always combine that as a whole. And so I had a race ethnicity question. But as this has unfolded, and I'm part of this larger civil rights work, whatever, right? It came to be that what I was doing as a researcher made practical data sense, because I was trying to address sort of the missingness of race, because Latino is an ethnicity and not a race. And so but basically if you're Latino, that's it. What it raised up is that there are groups who may actually not think of them as the same. So Afro-Latinos, they would select Black and Latino. And they felt, for example, that by combining race ethnicity into one, that they will be made invisible, that they will be assumed to be like white Latinos versus Black Latinos. And so I bring sort of this example to remind us, right, that when we're trying to make data decisions, right, with demographics, that it may seem simple at first, but we may not understand the implications of that decision making. And so again, the feds are going to make their decision next year in terms of the recommendation, but it's important to at least capture that as you're going through your decision making about how to gather data, how to either reconstruct or co-construct, that you understand from your different members of your community what that data represents, right? The fact that race and ethnicity is actually not the same thing. they are social constructs, and which means they may change over time. Right. So now we may have a Middle Eastern North African. They were white probably in Vermont. Maybe 5 years from now, it'd be a totally different ethnic groups. Right. So I think the way I think to deal with some of those challenges I'm recognizing is before you make some of those data decisions, that you really understand what is that data around demographics telling you, and what is it not telling you, and what are the assumptions under that. And if you don't talk to the diversity of your community, you may actually make decisions about your data that may have unintended consequences that's likely to harm those who may not be the majority in that community, in that society. And so I think that's part of that. The last thing I will mention too is, as we think about the idea of race, knowing that race is a social construct, a lot of us are trying to capture what is racism, right? Like, what are the things that race is sort of a proxy for? And so as you think about your demographics, what is the demographic telling you? Is it really about the people and the advantage or disadvantage? Or is it about the other things? Like, what are the opportunities that they're close to? What is more available to them? As Shantel, mentioned, right? What are the access points? What are the experiences and the outcomes? And are you really measuring that as opposed to the racial part? So I think it's think through, what is your demographics telling you, and how are you interpreting that?
Thank you, Iheoma. Carlise.
I echo all the things Iheoma just said. And I think I'll talk a little bit about some of the challenges, again, just kind of from the context of data integration. And I think they're similar, but I also think there's opportunities in efforts to kind of combine data that might help to move some of these challenges forward. So I think first one, similar that Iheoma mentioned, that programs have different demographic categories and definitions. So when you're wanting to combine these data, it's really hard. Like, I think one example, maybe extreme, but actually maybe more common than we think. One state was trying to combine their race and ethnicity categories. One program had 64 different categories. Another one had 5, right? Like, what does that look like? And sort of, but I think the opportunity that I think we're seeing in sort of these data integration efforts is knowing that and having a conversation about like decisions that different programs are doing that also is about sort of what Iheoma was saying, like, well, if we're going to aggregate these together, what does that look like? What does that make sense? And how can we really interpret that, and doing that in partnership with community organizations to make sure that what you're representing accurately and based on how communities view and filled out these forms. I think the other piece is that you don't always know who's filling out the race and ethnicity information too. And so we've worked with states where, or it's missing, we get a lot of missing data. Integration is opportunities for, say you have a caseworker that talking to that family and like filling out that information. They may have more complete information about that family's demographic information, but also their circumstances, and linking that, sort of understanding that across programs and using that to fill in missing information is another opportunity by integrating data. All this requires clear documentation about how data is being collected, who's filling it out. We are huge fans of data dictionaries as a start before you even move into connecting demographic data, because then that'll help you what other questions you need to ask moving forward. In terms of missing data, I think an experience that I've had in the past, we were trying to collect data about languages spoken by programs as well as families requesting care, and we had a lot of missing data. And in that instance, when people spoke English, they just left it blank. But from a data perspective, leaving data blank, we're not able to know what that language, that family, or that particular early childhood professional speaks. And so in that instance, it was a matter of going to the programs and explaining, like, this information is going to be used and collect for this. And it was more of like a training and a data management piece to go back. And it improved a lot of the missing information, because I think a lot of times we're using administrative data and people that are entering it in don't know what it's being used for. And if it's not serving a purpose at that moment for the program, then it may be missing. And so again, missing data could be helped by integrated data. But I think the last piece I just want to sort of put in there that comes up a lot when we talk about data sharing is just that demographic data can be sensitive and identifying. And it's really important that when we're collecting and sharing information around children and families, that we're making sure that personal information is being kept secure, that it's not being accessed by people who shouldn't access it, and that the privacy of children and families are being protected when it's shared. And so there are different ways that we talk about this, using unique identifiers so that we're only connecting data that's needed, that's necessary, and that we're aggregating it so personal information isn't being shared, that we have rules to suppress small sample sizes, because the more demographic data we use, particularly if you're talking about like rural communities in Vermont, the easier it is to identify a child that may be an early intervention, a child of color that's accessing a specific program, and to be really careful about that. And then also just to communicate clearly to families when they're sharing information about themselves, like how that information is going to be used, and that they're really knowledgeable and consenting to any other way that that data is going to be used. Because again, that's going to impact the type of data that you receive and like give you more accurate like confidence in using it when the person entering that data knows what it's for.
Thank you, Carlise. Shantel?
So I'm going to echo and refer to everything my colleagues just said, because they're much more steeped in actual data collection and in kind of the nitty-gritty of data systems than I am. But I'll just add a couple of things. I think building on some of what Carlise was just saying, right? There are still places where even asking the question is difficult. There are still states where asking the question is, if it's not federally required for a particular program or funding stream, not all states are open and ready to embrace that. Obviously, we've seen states, obviously we've seen all of these laws passed and all of this anti-CRT and diversity training and whatever not. And this is disaggregating data and even asking the question, right, at the state level and lots of state systems is still just difficult. So that's where we're starting in lots of places, right? There's such this heavy narrative, right, of the land of equal opportunity and post-racial society and all of this other stuff that makes this idea of being race neutral, right, the status quo. And of course, that is part of the design of systemic racism, right? That's the point, that we keep it that way. And so even beginning to break out of that by asking the simple question, right, is a challenge in some places. And I think, Carlise was just talking about the need to really protect that information, right? I think that there's just a layer of additional challenge where, for example, if you live in a state in where some state systems, such as the Department of Education, right, might have hostile policies to Spanish speakers or immigrants or different groups, right? But that is the state entity that is holding and collecting the data, really having to balance the importance of counting folks, right, for the purpose of fair resource distribution, ensuring needs are being met, all of these other things that we know are really important, with the potential of the harm of being identified, right? Of course, we talk about that all the time with documentation, immigration documentation, but like it goes beyond that to even the language you speak at home and being identified as a dual language learner and so on in some places. So I think those are some of the things we think about a lot with the challenges of collecting demographic data. I think Carlise already spoke to the matter of coordination and just the state of early care and education and the kind of splintered system that we have that often, don't talk to each other across state agencies. That's a problem. I think another issue that we see is, especially in some of the federal data that we analyze, is the lack of ability to cross demographic variables to better understand the AEO of kids who hold multiple marginalized identities, which is really limiting, obviously. So for example, IDEA data, some of the data in IDEA, you can examine children's race, right, as it relates to disability category. You can examine disability category as it relates to where the child is receiving services, right? Whether they're segregated or self-contained, whether they're included in a gen ed classroom. But you can't look at those three together, right? We can't look at Black children with, intellectual disability who are where they're receiving services in particular. And so that level of disaggregation is really important to understanding access experiences and outcomes. And when our data systems aren't set up in a way to really take all those pieces into account, it's really limiting. So I'll stop there.
Thank you, Shantel. Before we ask our last question for panelists, I'm seeing the prompt in the chat as well. If you have questions that you would like addressed in the discussion portion, please put them in the chat bar. And the last question for our panelists is, what is the top most important lesson that you and your team have learned as you've been tackling equity-focused data efforts? And I also recognize that we are asking our top 3 leaders across the country to answer in 3 minutes when they could actually fill a full day seminar on this. So really proud and excited to have you all here and appreciate your best efforts at being concise in this area when this is a really challenging topic to even discuss.
So I will start us off, you require a whole 10 years worth of conversation. But I will just say, when I think about the top 3 today, right now in this moment, is that I think you want to at least have data that communicates clearly, right? That a lot of people who don't need a whole PhD, MD, EDD, PD, whatever, right? So they can communicate really well. It could tell the good, the bad, and the ugly. I will stress though, right, especially because we're focused obviously on demographics for a lot of the conversation, is that you want to really be careful that the data, and when you analyze it, does not continue to perpetuate certain belief systems that people have. So if you have data that you break it out and all you do is just show, oh, look, a lot of the Black children or Latino children are likely to live in poverty and et cetera, right? So it continues to show that same level of quote unquote pathology. It's important that it is not put out there without context, without literally layering out that certain groups of children are not living in poverty or have unemployment rates or whatever the data is, not because they personally chose it, right? So to understand the fuller both historical and contemporary context. So it's really important that data in of itself doesn't stand without really clear inquiry, context setting, and so it's important that happens. And the third thing I think is really important, right? Because I think people see data as just facts, right? Yes, numbers could be facts, but it's important that it's not taken without a clear narrative with it. So I think when you're thinking about equity, and the question is, how do you define equity, right? When I think about equity, is really about how do you just make sure that those who are furthest from opportunities, that we remove those barriers, and not every person, every kid, every family has the same barriers. And for some people, it's been since the inception of this country. So it's really important that when we're talking about equity in data, we don't talk about equality in data, right? We really, really are clear about what are the benchmarks that shows who has been furthest away from opportunity and who are we trying to really target, but also make sure that we're not saying that there's something inherently problematic with this group or those with multiple marginalized identities, that really there's a system that contributes to this sort of continuous sort of disparity. So to me, part of equity-focused data efforts must really tell the full story and not really just show data and hope that people are able to interpret it clearly. And so those are kind of my big 3s that I would encourage.
Thank you, Iheoma. Carlise?
Okay, so I didn't want to repeat, but I agree with Iheoma's first one so much. I do want to, it was on my list too, just in terms of putting the data in context. I think we talk a lot about communicating that we can't present demographic data and just have the reader fill in the blanks regarding why disparities exist in our data, and just how important it is that we do put it in the context of institutional policies, discriminatory practices that have affected specific groups. So I think we talk about, you don't want to talk about health disparities and not include factors about what contributes to those disparities, such as lack of access to resources like health insurance or environmental factors that might impact specific communities. So I think as we think about demographic information, that requires a context that's for your particular analysis and report, that just shouldn't be filled in. It should be really explicit. Along with that, really acknowledging though the potential bias and the limitations of administrative data. So sort of my lessons are tying back to my challenges. As I mentioned below about, the data are collected and defined. It can be biased in terms of who's reporting it or if it's being collected for a particular purpose. And it's just important to communicate these limitations so that the data can be used accurately. And while I know I have been talking about the advantages and benefits of integrating data, and I firmly believe it's a valuable tool to understand like how children are being served across programs. It's also important to acknowledge that often that these represent only a subset of populations of children that benefit from publicly available programs. And often the data is limited to the federal and state reporting requirements about what's being collected, as Shantel was saying. And what we know about the state and federal reporting requirements is that these often are written not to reflect the issues or the vernacular that are used by local communities. So it's really important to consider other sources of evidence along with demographic data or administrative data, as I'm thinking about, that are not captured in these data systems, and that happens through processes that really allow communities to share information about themselves and their experiences using their own words. And that'll be is a really important way, I think, next step. And then the last is just promoting transparency around data use and parents' rights around their own information. As I was saying before, a lot of times when we're talking about these data systems, we talk about the importance of talking about data privacy and security policies upfront and first. Surveys that we've done of states developing the systems, I think we've been challenged to see that there's less that are actively putting public information on about these systems or providing vehicles for public comment, so that there are opportunities. I think it's more so, but really that there's an important vehicle for families and childcare providers and programs whose data are going into these systems to have a voice in that, and that we're really crafting a plan to be responsive, and being transparent about the data. I'm always a fan. Data that is used gets better. So I think the more that we are sharing and making clear how data are being used, the better it'll get. So thank you.
Thank you, Carlise. And Shantel.
I think just to drive that first point home that my other two colleagues made, really again, ensuring that data is in the context of history and that we are including an analysis of root causes of disparities whenever we talk about disparities. I know that, disproportionate discipline, for example, comes out a lot, right? And Black children being consistently overrepresented in all of the forms of discipline, of harsh forms of discipline. But not often enough, right, do we then pair it with the finding that there is no research to suggest that Black children behave worse or have more frequent misbehavior, right? And two, that this is just the contemporary manifestation of what has been historical violence, systemic exclusion of Black people and children over the course of history in education systems and in all of the systems. And so really moving beyond just talking about health disparities or educational disparities or whatever, right, to really understanding why those exist, because if we don't understand and walk them back, right, in terms of why they exist and how they exist, then we can't undo them, right? I think the second piece is understanding the contemporary policy context, right? I mentioned the example earlier on just asking a question in some states can be dangerous for folks, or the cost is outweighing whatever benefit will come from research to do that. And so really understanding and considering all of those factors, right, in who is in charge of particular systems and what can they do with that information, is I think really important, particularly when we're talking about data from folks who have historically been and are contemporarily marginalized in our systems. And I think the third piece, right, in places and in conditions that want to do the right thing, right, really being, again, clear about what we're collecting, why we're collecting it, how we're using it, and then actually using it to improve conditions, right? Actually using it to inform and change our budgets, actually using it to analyze our policies and our role as, I'm not a systems leader anymore, but how systems leaders and policymakers and organizational leaders and program leaders can actually change things, right, to address access or experiences, to really get at and close disparities wherever they exist. I'll stop there.
Thank you all. Incredibly powerful considerations for all of us in the state of Vermont and those across the country who are really thinking about how we are using data, what we're using it for, who's missing, and these very broad considerations for how we do this better. We have a couple of questions that I want to transition to in the chat, and I'm going to invite folks who are in a physical space and able to turn on your cameras for the discussion portion to please do so now. But the first question in this discussion section is coming from one of our early childhood partners. And it's about data analysis in the rural context and in a state like Vermont, and the recognition that it can be incredibly challenging to do this well because of the low numbers and the reporting and making that information publicly available in the context of also prioritizing confidentiality. Is there a state or many states that have rural counties like Vermont does that you think does a really great job of equity data collection and making the best of this situation? So what are those lessons learned from some of the other states across the country who are similarly situated to the challenges that we face given the rural nature of our state? And I'll open the floor to any one of our panelists.
So I'll start, and I will probably point blank say I've never looked at that particular question at a state level, right? Because I guess oftentimes I just think about data that is collected writ large, regardless of whether it's, and obviously here in North Carolina, we have both the rural communities and we also have obviously urban, suburban, et cetera. And so of course, part of the question, probably part of what my head is going is like, right, you have sort of rural, which is less people, is wider. So I think about the methodology of how do you gather data in a more rural community, right? That make sure that you don't have missing data. You can get the data quickly when you can, but also does what we call anonymity, at what you just mentioned, right? So how do you have accurate data and also anonymity? And I would just look at the way, in some ways, the feds do it, right? Which is in essence, they're collecting a massive amount of data, but they're also trying to ensure that somebody can basically get the data, put it together and identify like their neighbor, right? Whether you live in a rural community or urban, they have those concerns. And what they in essence do, they have a few things. One is they can say if there's a small cell, you really don't disaggregate at a level that you can identify people. So I think you have to have some data governance that really sort of says that. The other thing they also do, which some of us may not like, is that they basically they have a whole process, but where they basically introduce noise so that you cannot identify somebody easily, right? When you're talking about sort of a large physical space, but with very few people, you're trying to make sure they're not identifiable. So you introduce noise, and there's a whole process that you do that in many ways. And so I would almost say that you can lean into what the feds are doing and just do it on a smaller level. But of course, you have to be careful how you do it, because you still want to know, when you're talking about rural communities, they're less likely to have all the access to resources and supports. And so you don't want it to get to a point of where you're creating so much noise that you literally don't even know what you have. So I think it's really a matter of figuring out at what level could we sort of collect the data. At what level could we do some of the intersectionality? Like, can you figure out, okay, I want to collect data on, children who are infants and toddlers, who are Latino, that may have parents who may be mixed status, for example. So there's certain things you may not be able to do. And I think you have to, in some ways, be okay with that. And the other option could be, and as a mixed methods sort of designer, is really think through maybe a mixed methods design, where you can collect data. You may not be able to disaggregate a level that makes it easy to figure out who people are, but then collect other richer data that can give you some insights. But I'm hoping my other colleagues can have a stronger answer.
Iheoma, I think you said the one I was going to say. I'll add one just in terms of I've worked in several research projects in states where you have many rural counties and then you have larger counties. And in efforts to try to make statewide reports and do comparison, we're always running into instances where we have data for larger geographic areas and not for more rural areas. And so as Iheoma was saying, like introducing noise and doing simulated data sets, particularly when we're wanting to disaggregate, it allows you to get the statistical accuracy, but not the individual level, so that you could identify exactly who that child may be. The other thing that a strategy that we've used with other states we've worked with is to go to more of a regional basis, right? So like if there are ways to draw broader boundaries and combine data, that's a way to still hopefully capture. And again, this is something that's most best informed by communities, like those community lines. And so for what we would find is for some, we could get it at like the district or the county level, but for some particularly sensitive populations, it made more sense to do it at a regional level, because the second you disaggregated it by age or by like zip code, it was too identifying. So it can be a case by case basis, to where for some, maybe half of your data, you're able to get it at the level you want. And for other ones, you go to a more regional approach for that.
Can I add real quickly before Shantel, you go? It just made me think really quickly, because I may lose my thought. Is that I think, Carlise, your point exactly about sort of what level you may cross it at, right? Because you may do regional, like you can do congressional districts or school districts, right? So I think there may be some other options, but as we found out in one of the Blue Cross Blue Shield, like some things when you make it at a large level, it was hard to figure out, okay, where do we cross the boundaries? But I think exactly for rural, it may require a bit more of that cross boundary and the regional part.
And I'm good. I think y'all answered it beautifully. So
Awesome.
And
All
I was
right.
going to say, I run into this for census data too, where I end up combining 5 years and 1 year estimates so that I can include. And I think the key thing about for when I'm doing more rural communities is consistency. So sometimes you can get those larger sample sizes, but it's not going to be on an annual basis as you would for a larger urban population. You would be comparing like 3 years or 5 year estimates versus 1 year, but that's better than no data. And I think sort of there are in between data collections that you could do to kind of inform that, but also just kind of thinking about the consistency across different sources for the years.
Thank you. So one of the other questions is about whether or not any one of you has an elevator speech that could help some of our college faculty do a better job guiding the students who are studying early childhood education right in the beginning, to better understand the social justice grounded complexities and intricacies that you've been talking about so clearly in this session. What would your elevator pitch be to help our college faculty and our university faculty in guiding early childhood education students?
I think you had probably heard lots of little elevator speeches over the course of the webinar today, but I think I would just say switch the thinking to make it a required base starter course. That's where you start, and that's a whole course dedicated to that across the board, to really start to understand it more. I think those are kind of the directions that we want to start going, is really making sure that folks understand this at a deeper level, and it's a core part of preparation systems across the board, because it's hard to understand and know all of the things that have I mean, we're all still learning, right? So I would just switch the frame a little bit on that.
I thought my colleagues. I just ditto Shantel, and I guess I will just push on the idea further to say that, early kin education, right? Its origination started with the idea, particularly at least the contemporary version we know, started with the idea that we're trying to ensure that children for different opportunities, right, are provided with as much support as needed, so they can thrive and flourish like those who have advantages in many spaces. And so, and part of that is that we have to recognize that. And our continual job, and probably for the practitioners and others, is that we have to continue to keep that top of mind, is that you can't build something off of those who are disadvantaged backs and then leave them not being able to access it at a high level. So for me, is you can't talk social justice without actually doing it. And so that's how I would sort of think about that.
I was like flipping through my Rolodex of like different elevator speeches. I think one, especially when I'm talking to folks that are maybe interested in the field or wanting to get into the field, is really saying the part of life where we could have the most impact, we have the least data and information, right? Like when we think about like the trajectory of children's early learning and health and opportunities. And so, you know, it's really critical that we make sure that we understand and that we have data starting prenatal to really make sure that we are looking at all of the life course, right? So I think that's usually when I'm talking about this, to really focus on the importance of having data during that time to act, because you can have the greatest impact on children and families' lives.
Thank you, Carlise. Thank you all. I am seeing a few more questions in the chat. I want to be respectful of everyone's time and that we have 2 more minutes in a session that we should have done for 3 hours. And take these 2 minutes to say thank you to our incredible colleagues who have come virtually to Vermont to talk with us about equity-driven data efforts, and just wanting to appreciate the work that your teams are doing on the national stage, that you take the time to share this. And one of the major takeaways for me from this session is we can talk about data and we can collect a ton of data in the system, but if we aren't using it to inform decision making, we have a really big gap in how we think about what policies and programs are doing for our kids and families. So just wanting to express my deepest gratitude for the 3 of you for being here today. Thank you to all of our participants who came live and will watch this session a little bit later. And a quick thank you to our Data and Evaluation Committee who have been tackling this for the state of Vermont. I hope that we can use what we heard today to really move the needle for kids and families in this area. I want to do a quick plug that our next Data and Evaluation Committee meeting is on Thursday, September 21st from 1 to 2:30. And that focus is going to be on child hunger and nutrition security and building out the data development agenda for Vermont in this area. So what data do we have? What are the gaps and limitations, and what are the opportunities in that area? So if you are not a part of that incredible committee, you can send an email to data@buildingbrightfutures.org for that meeting information. Following today's session, we will send out a blog post that'll have the recording, compile links and resources from our panelists, as well as the bios and contact information. So thank you all for joining us this afternoon for inaugural Early Childhood Grand Rounds. And thank you again to our panelists.